Hi, I'm Ravneet Kaur from Khalsa College of Nursing. So today I'm here to discuss a very common topic, that is coronary artery disease. As we all know, the burden of cardiac diseases is increasing day by day. Cardiovascular diseases are the diseases which are leading to cause of premature deaths and disabilities in the human, and their incidence is on the peak day by day globally. So now what is coronary artery disease? So coronary artery disease develop when the major blood vessel that supply blood to your heart become damaged or disease. So coronary arteries are the arteries which supplies blood to the heart. But when they become damaged or diseased or blocked with accumulation of fat, calcium, proteins and waste material from the cell, this will lead to narrow the lumen of the coronary arteries, and this will lead to partial or complete blockage of the coronary artery. Then what are the risk factors which are contributing to the coronary artery disease? They are divided into two, that is modifiable and non-modifiable. Modifiable includes, first one is a high BP. When the person is having a uncontrolled high BP, this will lead to a narrowing and the blockage or thickening of the coronary arteries, which will limit the blood flow to the coronary artery. Then next one is a uncontrolled or high levels of the cholesterol level, that is a high level of HDL, low level of LDL and high level of triglycerides. Then next contributing factor to CAT is a high blood cholesterol level, that is a high level of LDL and low level of HDL. Then next contributing factor to CAT is a diabetes. This is the main factor which is associated in increasing the risk of coronary arteries. Diabetes type 2 and CAD have a similar characteristics or share the similar risk factors such as obesity and a high BP. Then the person who is having a sedentary lifestyle or having a less exercise in her daily day routine, which will also contribute to coronary artery disease. Then the person who is having unrelieved stress in his or her life will worsen the disease condition and lead to damage to the coronary arteries. Then the next contributing factor is unhealthy diet. Eating too much of processed food which are containing trans fats, saturated fats and high amount of sugars and salt will also contribute to coronary artery disease. Then next factor is a non-modifiable factors. So the person who is having a family history of heart disease which is associated with increasing a higher risk of developing of coronary artery disease. That is, if any member or any family close relative which is suffering from coronary artery disease in a very early age. Then next is a pathophysiology. What are the physiological changes or pathological changes takes in place inside the body during the process of disease condition? That is due to the causes, that is high level of fatty diet, hereditary and other causes which will contribute to lipid cholesterol formation inside the epithelium layer of the coronary artery, which will further lead to formation of a fatty streak that will further proliferate and form a fibrous plaque, which will lead to complete or partial blockage of the coronary artery. Then are the signs and symptoms that is experienced by the patient during a coronary artery disease. So some patient may experience angina, that is also known as a chest pain. So this is due to the narrowing of the arteries. Patient may feel pain in the chest that is triggered with the activities such as physical activity, or patient is having any kind of emotional stress. Then next is a shortness of breath. If a patient can't pump, his heart is unable to pump enough blood to meet its body requirement, patient may develop a shortness of breath or extreme fatigue during the time of any physical activity. Then some patient may experience dizziness, woozy, fainted or unsteady, or may feel weak. The other symptoms patient may experience like dysarrhythmias or ECG changes can be detected. That is, ST segment changes or T wave changes can be seen in the ECG findings. Then some patient may also experience nausea, vomiting, the skin may become cool, clammy to touch, and appearance may be pale. So this is all about the sign and symptom that are experienced by the patient. Then are the diagnostic evaluation or diagnostic test, that is to rule out the condition. So first of all, the first step is to collect the history from the patient regarding his personal history, family history, or any kind of surgical history. His personal history data can be collected from the patient. Then is a echocardiogram, that is known as a ultrasound of the heart, that is to identify the heart disease. Then is a nuclear imaging, this is known as a cardiac positron emission tomography, that is PET. This is used to detect the CAD, that is along with this procedure the PP can be monitored and ECG findings can be seen. In this, a little amount of tracer injected inside the patient body and images can be taken that shows the blood flow or any kind of narrowing can be detected in nuclear imaging. Then next test that is done is cardiac exercise stress test. So in this test, the heart ability in response to any kind of stress can be detected. Environment is created in which the patient has to ride a stationary cycle in a controlled clinical environment. And in some cases, a medication that is also used to stimulate the heart instead of riding a stationary cycle. Then is a ECG findings. So ECG recordings can be done to check the electrical signals of the heart. In this, the patient ECG can reveal the previous heart attack and also any heart attack that is in progress. Then cardiac catheterization can be done. In this, a dye is injected, that is injected through an artery or a vein to show up a better images or any kind of blockage, that is single artery is blocked or any multiple artery is blocked. So then are the lipid profiles. So in this, the blood test can be done, in which the first test is lipid profile, in which LDL, HDL and triglycerides level can be checked. Then is the next is a CRP, that is C-reactive protein test. The next blood test which is done is natric uretic peptide test, in which if the heart muscle get damaged, it will produce BNP, that is a brain natric uretic peptide in a bloodstream, that is ease to strain the pressure on the heart, that is released during the time of if the heart muscles get damaged. Then is a troponin T. So this is also an cardiac enzyme which is released when the heart muscles get damaged. So these are the diagnostic evaluation. Then next one is the treatment. The first line treatment includes the drug therapy, in which various drugs can be given to the patient. So first drug is a vasodilator can be given, which includes nitrate, that is isosorbide dinitrate and isosorbide mononitrate can be given. The next class of the drug which is given to the patient is calcium channel blocker, which includes verapamil and nifedipine. Then the next drugs are beta blockers, which is used to decrease the blood flow on blood burden on a heart or workload on a heart, which includes a propranolol can be given to the patient. The next class of the drug which is given to the patient is anticoagulants. For example, is heparin can be given. Next is a surgical management, which include first procedure is a PTC, that is percutaneous transluminal coronary angioplasty, and this is also known as stent placement. In this, doctor insert a long, thin, single catheter, tube-like catheter, narrowed, that is inserted in the narrowed part of the artery. The wire is guided with a deflated balloon pass through the catheter into the narrowed part of the artery, and then the balloon is inflated, which will compress the narrowed part of the artery, and stent is often left open to keep the artery open. So this is a PTCA. Then next one is a coronary artery bypass grafting, CABG. In this, surgeon creates a graft bypass to a coronary arteries which become injured or which become diseased. Two, that is, bypass is created from taken the artery from the other part of the body, and this allows the normal flow of the blood. Then the patient, this can, CABG can be done in cases of when the arteries are multiple in number. So this is all about the surgical management of coronary artery disease. Then is a prevention. What are the preventive measures patient has to take to that may help to slow down the disease process? So in this, the patient has to quit the smoking, stop the alcoholism, then check his or her cholesterol level at the time, keep the diabetes under control, eat a healthy foods such as vegetables, whole grains, nuts, etc. Then the person has to exercise regularly, follow a active lifestyle, and to, that is, to reduce his excess weight, then manage any kind of stress in his her life. Thank you. This is all about my topic.